What about a woman who has already had a baby that has, what about for Miss Ashley, because she's had a baby with a neural tube defect?
4.
Exactly, 4 milligrams. Now what if Miss Ashley says, oh, I'm not having any more babies, this is my only baby?
No, she needs to be on some
Still do the
What'd you say?
She needs to be on some type of form.
Yes, exactly. Because this baby was accidental, we guessed because she didn't know she was pregnant. So whether she says I'm not having any more kids or I'm having 10 more kids, she needs to be on that 4 milligrams of folic acid. Yes, ma'am. It can be genetic too, yes. So we might want to do some genetic testing to see what that baby has and what that looks up with mom to see if that's a cause. And that could be a potential factor. Yes, that would be a good one to do. I would have to look more into that because I'm not so sure about the genetic component of it, but I can look more into it for you. All right. And then, so the multivitamins can give a woman of childbearing age that folic acid they need if they just need the 0.4. If they need the 4, they're going to have to be on a different type of folic acid supplement. So that'll be a huge teaching point with Miss Ashley, okay? And then prevention is the best treatment. You see here, it'll prevent 50 to 70% of all cases. That's a really high number of a type of prevention. And that, doesn't include the genetic components like we were talking about. So that's for a baby who doesn't have that genetic folate pathway disorder or syndrome that's associated, this is going to be our best method of treatment. It's just to prevent it. All right, so fetal surgery, like we talked about. I'm not going to talk about this much, just for a second, but there has been an increase in fetal surgeries and of people who do fetal surgeries. I think Atlanta is one of the places that does fetal surgery around here. And what they do is they go in between it's 19 and 26 weeks. So you have to find it early enough to be able to go in and close it. And they will go in utero and close the defect. And so I pulled up the study to see if that changes outcomes for these babies. And like I had said earlier, I don't know if I said it to everyone or just a group, but the damage that they have is not reversible. So once they have the damage, it's there, but it can lessen some of the associated symptoms with it. So this study, it was done in 2011 called Management of Myelomeningocele Study. And so they followed 183 women who were diagnosed, and 40% of them who had the in utero surgery needed a VP shunt, so the hydrocephalus. 40% of the ones who had the surgery. 82% needed the VP shunt, who had surgery after birth. So that's a big jump from needing the VP shunt for the hydrocephalus. Let's see. Another finding was that 42% of the children who had fetal surgery were actually able to walk without crutches, like this young girl that y'all were talking about was, by age 2.5. And only 21% of the babies were able to walk unassisted by that age in after birth surgery. So there has been some new revelations about this, and there are some lessening of the walking and of the hydrocephalus associations, but there are still a lot of risks with fetal surgery too. So before we just say, oh, you should have fetal surgery on that baby, we really got to talk about the risk. There's risk to mom, there's risk to baby, there's risk for morbidity and mortality both. And and then there's also the risk that that baby will be born prematurely. When you go in there and you mess with her, you could put her into premature labor. And then if we think about if they did it at 19 weeks, then our baby's not viable. And even at 26 weeks, if they did it at the latest point, then there's a lot of other complications that come with premature babies at that age. So just a little blurb on fetal surgery. Do we have any questions about neural tube defects? No? Okay, great. So we are going to do, and then I included in y'all's slides, there's some really good references out there. If y'all are interested in learning more about it, I put them in your slides. Okay, so we're just going to do, have y'all ever used Poll Everywhere in Miss Grizzetti's class? No? Okay. So this is just a review of what we talked about, and we're going to do Poll Everywhere for this. So it's going to come up on there, and there's going to be a question, and then you all text in your answer, and it'll show what we got, okay? So, let me figure. So it'll tell you what to do right here. Look, and you can do it on your computer as well if you use this address. And then what you'll do, so you'll go ahead and text this right here, Chelsea Steve 845 to this number, and you'll join the session. okay? So once you join the session, it'll tell you you can respond. So can y'all read that? Is it big enough for you to read? Okay. Oh wait, y'all probably need the number still, huh?
Well, it's right there. It's right here.
Oh, okay, great. There you go. This is my first time using this in a class session too, so I'm excited to see how it works.
You scroll.
Scroll.
Or the box at the top.
Scroll what? I'm sorry.
Exit, allow. Click
Allow.
allow.
Oh, sorry, you can't even read the question. It's a, go away. There we go.
Everybody on the answer. There's one person.
It's just 1%. It just does that. I feel like I should pull it away so that y'all can't see what Everybody. Yeah, so after you type in once you join it, then you type in the letter. I think the next one I'm going to pull away so you can't see what everybody else is answering. Is anyone else trying to get it in there? All right. We good? Was everybody able to get it to work? Okay, good. Well, this was, y'all knew exactly what it was. Latex precautions with these mothers and with these babies. You want to make sure that you educate on it. Good job. These aren't the hardest questions. All right. Okay, I'm going to take it away after you do it so that people can answer on their own. So which of the following has a sac that contains meninges, spinal fluid, and nerves? You've got A, meningocele, B, anencephaly, C, myelomeningocele, or D, spina bifida occulta. Okay? Does everyone, oh, it's not open yet. Oh, hold on. Now it is. Well, I can't take it away. Alright, was everybody able to get it in? Good. So myelomeningocele. What does meningocele have?
Yes, the spinal cord and the meninges.
Yes. No nerves. Exactly. Good. Alright. Okay, which vitamin deficiency is associated with the development? I know. I'm really trying to trick you.
I have this question on the exam.
Yeah, you write the exam?
I'm not.
Oh, you write the questions?
I'm waiting. I'm gonna wait and open it at the end. I mean, I think you all know the answer though. And I think they load. Or they did earlier. Okay, so yeah, there they go. That was weird.
See, just to let you
You
see.
do that on purpose.
It looks like somebody. It doesn't look full now.
Okay, good. Folic acid. And what's our recommendation? How much? Yes, and if they had one? Good. Very good. All right, 2 more.
This was her name.
Outside.
You see a snap one?
Okay, which of the following should the nurse put at first priority for a child with myelomeningocele prior to surgical closure? Good. What other of these might still be an issue with this baby, just not our first priority? What would y'all think? Skin integrity, yep. What about activity intolerance?
Yeah.
Yep, when they're getting older and if they do have the paralysis? Yep. Good. All right, our last one. This one's a little more wordy, I think. Okay, so we're awaiting surgical closure. What's the most appropriate nursing intervention? Here, I'll make it big then. Is that better? There you go. Oh, but then it went away. Hold on. Here, I'm gonna read them to you out loud, okay?
Like, you already know.
Okay, so A, place the infant in a prone position with the moist sterile dressing over the sac and assess it for leaks and signs of infection and change every 2 to 4 hours. B, place them in a prone position, leave the sac open to air, frequently assessing for leaks and signs of infection. C, administer IV antibiotics and place a dry sterile dressing over the sac. Or D, place the infant in a supine position with a moist sterile dressing over the sac and assess the sac every 2 to 4 hours. Do I need to repeat it now? All right, you're right. Good job. So, do y'all think that antibiotics might be a form of treatment for these babies, though? We're going to get them started on antibiotics for that risk for infection? Yeah, exactly. But we want that moist, sterile dressing over the sac. All right? Any questions?
Yeah, I'll do actually.
Yeah.
So that's before they've even opened the sac, right?
I'm sorry, what?
That's before they've even, like, the sac's been ruptured or anything, right?
Yeah, so we don't ever want the sac to rupture because then we start getting that leakage of the neural fluids. But this is before surgery, yes.
So if you put, like, right before surgery, I mean, would you, if you put that dressing on it, couldn't that maybe rupture it and you're not able to view the sac itself?
Yeah, that is a chance that we have, but we want it to be moist. That's one of the big things why we want it to be moist, because if it was not moist, it could stick to it, and when you peeled it off to look, it could rupture the sac. So we want to make sure it's really saturated and put on there, because we don't want it open to air, because air can bring in an infection just as much as us touching it could. You know what I mean? But that's why we're very frequently assessing it. Most units are going to be every 2 hours assess the sac. You don't do it every 1 hour just because you might risk rupture or infection, but you want to check it. And that's why the best thing is to go into surgery as soon as possible for that infection risk. So. Anyone else? All right. Thank y'all. Let's take a break. There you go.
Today is a 12:30 day, if you look at your calendar, so we still have some more to do. Y'all take 10 minutes, and we'll move as quickly as possible.
Oh, thank you.